Hello, everyone, and welcome. Today is June 4th, 2019, and our webinar topic is Don't Fear Medicare SNPs. Can you please raise your hand using the icon to just confirm that you can hear me and see my screen? Thank you, Sharon. Appreciate it. All right, thank you for joining us to dive further into Medicare Special Needs Plans. URL has partnered with Gateway to help get the most out of today's presentation, and we're lucky enough to have Brian DeVinney on the call with us from Gateway. My name is Christy Wilbert. I'm the Director of Medicare Marketing with URL Insurance. And before we get started, I'd just like to take a moment and mention a few announcements. So URL will be rolling out our Medicare Advantage online enrollment tool very soon. It's called Medicare Now, so keep an eye out for that. We're going to have all the big Medicare Advantage carriers on that platform. We're really excited about it. It gives you the ability to sell compliantly from beginning to end using technology. So the e-scope, everything is saved online. It has a CRM. You'll be able to sell face-to-face or over the phone. So if you haven't seen it already as well, on our website, URL is planning our 2020 trip to Charleston, South Carolina. We'll be taking our top 40 producers in all lines of business, so continue to push this year. We are posting your trip points every quarter on the website. If once you sign in and go to my URL, you can check out your trip points. It will just let you know if you're in the running or not, basically. If you are, it lets you know. If you aren't, it lets you know so you can continue to push your sales. I'm personally very excited about today's topic because we get a lot of calls from agents when they are writing a SNP, maybe for the first time or they haven't done it often, to just confirm everything they're doing is correct. And we feel there's a lot of fear surrounding the sales of the product. So the main thing to keep in mind for a SNP is that it's an HMO. So it's extra important to be checking doctor networks, which is something that you should be doing regardless. So no changes in how you're selling the product. If a person is dual eligible, it's ultimately the best choice, and I can say best because I'm talking to agents and not beneficiaries, to be putting them on a SNP, because these plans offer additional benefits built in to the plan specifically for their needs that they're not going to get in an MAPD. And Brian will go over those additional benefits here shortly. Just a few housekeeping items. There is going to be a question and answer at the end of the session today, so please make sure you're typing them in as you're thinking about them. You'll receive a copy of today's slides, and it will be recorded. We record all of our webinars. They get posted to our YouTube page and then also our training library for your reference later. And please remember as well that we have our Orion Referral Services platform. So if you ever come across a product that maybe you're not contracted with, or your clients are moving to another state that you're not licensed in, URL can help your client on your behalf, and you'll be paid an Orion referral fee. So if you have any questions about that program or you'd like to talk to me more, you can find me at extension 152, and I'd be happy to discuss that with you. And at this time, I'd like to turn control over to Brian DeVinney, Supervisor, Medicare Sales and Marketing Training at Gateway, to get us started today.
Thanks, Christy. Good morning, everybody. Thanks for taking the time out of your day to get with URL and Gateway Health Plan here to get reinvigorated into the D-SNP marketplace. So what we're going to do today, I put together basically a little sales playbook here, and we're going to go through, why you want to work with Gateway, why you want to sell D-SNP, what the products are, how do you take it to market. So it's going to be a pretty in-depth look at D-SNP, but not so in-depth that it's going to blow your mind. So getting started, I'm having an issue with my computer, so Christy is going to be in control, so I'll be saying, hey, we'll be starting on slide 3, so just bear with us as we go through that. So Christy, if you go to slide 3, so why do you want to work with Gateway? So one of the first reasons is we're 100% focused in the D-SNP market. We don't have any outside distractions with an MAPD or anything like that. We streamlined this last year, and we're a 100% exclusive D-SNP Medicare company. So as you can see here on the chart, we've been around since 1992, and we were founded as a Medicaid product in PA. In 2006, we had our first D-SNP product that was launched into PA as well. 2014, we expanded the Medicare into Ohio, and then we also had Medicaid expansion into West Virginia. 2015, we went Medicare into North Carolina, expanded the Medicaid in Delaware, and in 2017, we were awarded all 5 zones in the PA Medicaid world, and then we also launched Medicaid in Arkansas. So, you know, we're around, we're expanding, we're doing a lot of great things. So flip to the next slide, and you can see, you know, how many people think of Gateway as being, oh, it's a little smaller company, but whenever you actually break it down, we have right about 50,000 Medicare members in our footprint currently, and 285,000 Medicaid members. So we serve 335,000 plus lives across our footprint. So much larger than a lot of people think. Next slide. Why Gateway Health again? We have a tremendous marketing system. So we have flyers and banners, brochures, window clings, pull-up banners, all kinds of good stuff like that. They're all customizable with your name and phone number, and you can see a couple of those examples on the right. The other thing that we do that I'm not aware of anybody else doing is we actually have a mailer that you can go in and download a mail list. So it's through an Excel spreadsheet, and you can do up to 1,000 pieces of mail, and we'll pay for it for you. So you download that Excel spreadsheet, comes in, and you can put your name, your phone number, email address, and then whenever it comes, if it comes back to us with the business reply card, we actually have it tagged to you where it will come into your CRM, which is our lead management system, directly to you, so then it's safe and you can work that lead. So all of those will be coded to you, so it's mail, phone, and a BRC that we're all paying for you. And like I said, that's up to 1,000. So, and the format again is Excel spreadsheet. So if you're interested in doing something like that, you'd want to get with your agent manager, who is Chris Duggan, and he would be able to get you the format, the layout for that Excel spreadsheet, and he could probably get that to Christy as well, and then she can send that out to everybody. So that would be great. All right, next slide. So why Gateway Health again? We have a tremendous sales team. You can see here we have broker managers, and 3 broker managers in Pennsylvania. We have Dan Meisner, Chris Duggan. So if you're in the eastern part of the state or central to east, so Harrisburg east, that would be Chris Duggan, and that's Chris right there. And then Rob London is another agent manager. And these guys, they're tremendous at product training, sales training. If you're looking to help grow an agency, you know, we can help with recruiting type of things, co-op opportunities, the CRM system, which is again the client records management system. They're experts at that and can help you with that stuff as well. Field training, and then all of them have been in the field just like you guys in the past. So they have a lot of experience on that end. The other side of it is our agent support, which is our 800 number. They're amazing over there. Everywhere that I go and talk to people throughout our footprint, it is consistently praised as one of the best experiences, if you could ever have a great experience, whenever you call into agent support. So they answer the phone. They can do real-time eligibility checks for you, so they can make sure that the person that you're sitting in front of is actually eligible for one of our plans. They can answer commission questions. They also take care of any application issues. If you are in a remote area and maybe you're not having very good service for internet, they can look up providers for you. They can look up formulary, and they can also do hierarchy changes. So they're very skilled and versed in doing a lot of different things. All right, next slide. So we should be on slide 7. So why sell D-SNP? So, you know, D-SNP is going to be a person who is Medicare eligible and Medicaid eligible. And there are full duals, which are full Medicaid, and then there's partial duals, which are partial Medicaid. That's all predicated on that person's income and their asset level. So the easiest thing to do is call agent support, and they'll be able to tell you what plan they qualify for in our 2 plans. So if we go to the next slide, so why sell D-SNP? You know, in January of 2011, the baby boomers began turning 65. And since then, it's roughly about 10,000 people a day are turning age 65. So that's a lot of people. By the time that last person in that generation hits retirement age, which is going to be right around 2029, about 18% of the U.S. will be at that age. So we're looking at roughly 16 million dual eligibles throughout the United States at that point. So what does that mean to you? So let's go to slide 9. And you can see on our footprint, right now in Pennsylvania, there's right about 454,000 dual eligibles in the state. Only 142,400 actually have a plan. So there's over 300,000 people in Pennsylvania who don't have a dual SNP, D-SNP plan. So the opportunity is still unbelievable in this state. You know, I talk to a lot of people a lot of times, and one of the misconceptions is that it's a saturated market. It's hard to get out because there's so many people that are already doing this, and that's just not the case. And you can also see our other footprint, North Carolina and Ohio. You know, the opportunities there are just as good, if not better. So, you know, the dual SNP marketplace is something that is, in my opinion, vastly underworked by brokers. Next slide, so slide 10. So roughly 40% of that population, though, so that 454,000 is under age 65. So in Pennsylvania, that's about 185,000 people are actually under the age of 65. So you have to remember that anybody who's been on disability for 24 consecutive months would then qualify to be disabled. So they'd be on Medicare, Medicaid. So somebody who gets hurt at work, let's say, you know, they might be 32 years old. They can't go back to work. They, you know, did something horrible, and they're Medicare, Medicaid. You have special needs individuals who are able to then qualify, so that's a great market to get into. Some other ones that I'll get into a little bit later, but like blind associations, even though sometimes they're able to work, they still may qualify for Medicare, Medicaid, and there are some other ways that they would be able to qualify for our plan. So remember to always call agent support, and they'll be able to tell you right then and there. This also reflects in our membership. So 43% of our membership is actually under the age of 65. So it's a pretty big number, and it shows you that whenever you're out writing this, you can't discount the under age 65 population. And on our books currently, our youngest member is 18 years old. So, you know, you got to be looking and find these little niche, or not little, but actually rather big niche markets to get into, even within the D-SNP population. Next slide. Why sell D-SNP? You know, here at Gateway, we do pay lifetime commissions, and we pay new business on the 15th of the month. We pay renewals on the 30th of the month, and we do pay at the maximum commission set by CMS for each state in our footprint. And one of the other things that we would run into a lot in the past was people didn't want to sell D-SNP because people on a D-SNP could switch every month. One of our competitors did a study, and they found that the average MAPD is on the books for 4.8 years, while the average D-SNP was on the books for 4.6. So really not that much of a difference. And if we were all in a room right now, I would ask, how many people out there, by show of hands, would want to, you know, switch their health care every single month? I'm going to bet that none of you on the call would actually raise your hand, because who wants to do that? So why would somebody who qualifies for a D-SNP want to do that as well? Just, it doesn't make sense. So, you know, if you take care of the people, you answer the phone, do the same type of stuff that you would do for everybody else, they're going to stick just as well as a regular MAPD. Okay? Next slide. So why sell D-SNP again? So even though they have Medicaid and Medicare, you know, their Medicaid benefits don't cover everything. So if we look here, the column on the left, which is the what you may have now column, You know, in Medicaid here in PA, they do get a little bit of eyes, they do get some dental, but the eye care is based on their income. I mean, they're already low to begin with, and the lower their income, the little bit better that their eye care gets. And then with the dental, it's based on pain. So, you know, if they have experienced pain, they can get something with dental, maybe a cleaning, but it's nothing that's going to be able to help their day-to-day lives with their dental. So it's very restricted. They do have hospital stays, but you have to remember, Medicaid even has a network. Not every doctor out there accepts it. I was actually in the hospital a few months ago in the emergency room, and while I'm sitting there, I look to the right, and in the hospital, it says, we do not accept Medicaid right there in the emergency room. So I never thought about it, and now this slide even makes more sense to me as I talk about it. So you have to remember that. They do have doctor and outpatient care, but again, it's going to be limited to who takes Medicaid. So not all doctors out there are taking Medicaid. And then they do have a formulary type situation as well. So not all prescription drugs are going to be covered under Medicaid. So whenever you have a plan like ours or whoever else it might be in a D-SNP world, they still continue to maintain those same benefits, but on top of that, they're going to get more doctors, they're going to get more choices of hospitals because they get the network that plan has in place. And with Gateway, we have a tremendous network throughout Pennsylvania. So it's a very strong network. We probably have a lot of the doctors that these people are looking for and give them a lot of options they may not have currently if they're just Medicare, Medicaid. In addition to that, they get additional prescription drug coverage. So that's always a great thing. And then the extra benefits they get, they're going to get things like transportation. They get an over-the-counter catalog. They get better prescription drugs, or not prescription drugs, but prescription plans, vision, and then an enhanced dental plan as well. So we'll get more into that as we get going here. So if we go to the next slide, you know, why sell D-SNP? There really is actually decreased sales competition in the D-SNP marketplace. So basic reasons that we run into here, just people are unfamiliar with the different segments of that D-SNP market. People are generally, whenever they're working agents, we find, are looking at the 65 plus. They're missing out on roughly 40% of the D-SNP population if you're only looking at that 65 plus population. A lot of brokers out there, they're not sure how Medicare and Medicaid work together. So just that slide that I just went through, you know, it gives you the breakdown. Here's what they get in addition. I know whenever I was starting out selling in your position, I didn't have anybody training me. It was just, I was learning as I was going, and I would sit down with somebody that was a dual eligible, and they would tell me, I don't pay for anything anyway. I didn't know what to tell them, you know, so I had to learn the hard way. So hopefully this can help accelerate some of your learning curve here. A lot of agents don't ever see the numbers either. So what's the opportunity? We just went through that. The tremendous opportunity that we have in Pennsylvania and throughout our footprint, it's unbelievable. And agents don't see it, or sometimes they don't believe it. So, but it's there. And then they don't know how or where to find the prospects. So I'll get into that here in a little bit, but they are there. Once you have to immerse yourself into the D-SNP world to find the prospects, but it's just the same as anybody else. You got to be able to go out and find your prospects and get them to agree to an appointment. So we'll get into that a little bit more. Next slide. So 2019 has provided us with new regulations by CMS, where it used to be back in 2018, the D-SNP population could switch every single month. That changed this year. So they're allowed to change once a quarter. And what I believe is going to happen is it's actually going to increase retention. So if somebody were to sign up today for a July 1st effective date, this is the last month of the second quarter. So it's based on their date of the application. So if you met somebody today and you signed them up, they may have already used their change for this quarter. So it could have been they used in May for a June 1st effective. Whenever you call our agent support team, they're going to be able to actually tell you if somebody has used their change for the quarter. So you're not going to be spinning your wheels writing somebody who's already done that. But what does that do for you? Well, that lets you know that in July, you can go see them and do a comparison for them and find out if they're in the best plan for them. The one change a quarter, I think, is also going to maybe affect some brokers, and they just might avoid it at all costs now. They don't want to deal with it. I'm sure we all have friends and colleagues out there who just say, I'm sure you've never heard anybody say, gee, I'm all in on all these changes. You know, that's not generally the case. A lot of brokers out there, they just kind of don't want to deal with the change, and they may stop writing things. So again, it opens it up for you to go out there and write a lot of applications. You know, so as I mentioned, we're in a position to help determine if the prospect's already used that change. So again, agent support is the way to go. The other thing is, the quarterly thing is only the first 3 quarters. So October, November, and December, the only way you'd be able to write a D-SNP in 2019 would be if somebody has a special SEP. So it would be, you know, they move, or they're aging in, or if their Medicaid level or LIS level has changed. That's the only way you'd be able to write somebody for an October, November, or December time frame. The other way is it's going to be like an AEP sale then. So whenever I start thinking about this, everybody and their brother is out looking for the general population come AEP. Nobody. I talked to a ton of people at AEP, and not everybody, but a lot of people say they don't do their D-SNPs at that time. This opens the door to an amazing opportunity where you don't have anybody, it seems like, concentrating on D-SNP. You could go out and write all the D-SNPs over AEP, and you think about it. What's different than writing an MAPD? We pay the state maximums. We have lifetime renewals. They stay on average 0.2 years less, and that just might be, they might be in decreased health situation. So you start looking at it, it's a market that maybe you start thinking about attacking come AEP because of that decreased competition. So some of the SEPs then would be gain, lose Medicaid. You know, we went through that. They could be auto-enrolled into a plan by a state. So that more likely that's Ohio, and then passive enrollments again by state or CMS. So if we go to the next slide. So our Pennsylvania D-SNP, what is it? So we'll go to the next slide, slide 16. This is our footprint currently for 2019 in the state of Pennsylvania. So we have a large presence, you know, most of the major metropolitan areas and surrounding areas, that's where most of the D-SNPs are. If you go to the next slide, slide 17. What are their qualifications? So they have to be enrolled in state medical assistance at one of the following levels. They got to be QMB, QMB plus, Slim B plus, Slim B, QI, QD, WI. The great thing is you don't have to be an expert and know all of the income requirements and all that stuff. Just call agent support and they'll tell you right then and there what they qualify for. They have to live in that service area, and then they have to be entitled to Medicare Part A and enrolled in Part B, and they can't have end-stage renal disease. Next slide. So this is our full dual. So this is the Diamond plan, we call it. And it's Medicare Assured Diamond, and I have here all the extra benefits. So 2019, our Medicare Assured Diamond plan is in blue, and then I took all of our top competitors across the state, taking the strongest competitor benefit and putting it in here. So whenever you start looking at it, our dental plan, we have $3,500 allowance for comprehensive. So it's going to cover things like fillings, extractions, that type of stuff, 2 crowns per year. So that allowance is there, but then outside of that allowance, we have dentures every 5 years. So that does not count towards that $3,500. So that's a tremendous benefit. Our top competitor has $3,500 annually as well for their comprehensive, but they do not have dentures. Some of the other plans out there, they have a little bit lower comprehensive number, and they do have dentures, but those dentures count towards that comprehensive number. So if the dentures cost $3,000, then it would be $3,000 towards that comprehensive. So if they had to have teeth removed, that type of stuff, that could incur cost to your member. Vision, we have a partnership with Davis Eyewear. So anywhere that would carry Davis Eyewear is going to be free to the member. So they can get scratch-resistant lenses, progressive lenses that tint, they can get bifocals, trifocals, whatever it is, as long as it's a Davis Vision product, they can get that covered for them 100%. If they go outside of the Davis Vision network, or not network, but eyewear, then they'd have $200 annually towards glasses or contacts. Top competitor is $300, but nobody out there has a $0 cost eyewear program. So again, I think we have a pretty strong case there. Hearing, it's pretty basic. We have $1,500 every 2 years towards paying for hearing aids. There are two competitors out there that we compete with that they actually have $0 copays, and they have two different companies that they use out there. Transportation, we have 50 one-way trips, so that you could break it down and say it's 25 round trips, whatever it is. But we go from a 50-mile radius, okay? Competitor out there, there's one out there that has unlimited, but it's only a total of 25 miles. So if somebody has a doctor that's 13 miles from their house, which is very conceivable, they may have to go to the hospital to see their specialist, whatever it is, 13 miles, that's 26 miles total. So that could be a problem. Our trips will cover going to the dentist, going to the pharmacy, going to Silver Sneakers, which you see here that we have. So it gives them something outside the vision, dental, a chiropractor even. So there are ways to use the transportation not only to get to their PCP or specialist, there's some other things they can use that for as well. If it is outside the 50-mile radius in some cases, maybe they live far away and there's only one specialist, maybe they got to go to Philly and they live, I don't know, in Allentown or somewhere like that. That's probably going to be over a 50-mile radius. They can call and get an exception for that in most cases. OTC credits, so we have the over-the-counter catalog. So we have $300 a quarter. So in that catalog, there's things like toothpaste. Let me pull out, I got a box of stuff here actually. You can't see it. But we have one-a-day vitamins. We have toothpaste. We have toothbrushes. There's all kinds of good stuff. Deodorant. And it's just not, Frank's deodorant or Frank's toothpaste. It's brands that we've heard of and probably use every day. And that $300 a quarter goes a long way. Now, you see their quantity limits. Last year, we had somebody order 10,000 toothbrushes. So we had to put some quantity limits on our stuff here. So I think the maximum toothbrushes is now 6 instead of unlimited. So that's kind of funny. But the $300 a quarter does have rollover. So if they don't use any in the quarter, then that $300 gets rolled over. If they use half of it, then the remaining half gets rolled over. And it is prorated. So, the first quarter is already over. The second quarter is almost over. So you carry, if somebody signs up for June 1 effective, then they would have, I'm going to assume, don't quote me on this, but I would assume they have like $100 for that quarter prorated because there's 3 months in the quarter and it's $300. If they didn't use that, then that 100 gets carried over. And then it all expires on December 31st. If they don't use any of it, then they have to use it all by December 31st of this year, or else it would reset based on what the new plan is going to be starting January 1. We do have meals upon discharge. So if somebody is admitted to the hospital and they are discharged, they can get 14 days of meals, so 28 total meals. Now, they don't get a box of 28 meals. They'll actually get a call from the food service company, and they can customize their order, and they can say, hey, send me 5 days, take a week off, send me 5 more days. They can break it down however they want it. This is an unlimited benefit. So if they are admitted and discharged from the hospital 22 times this year, they can get this 22 times. Our top competitor is 14 days, 28 meals, but I think it's limited to 3 uses. Oh, I missed the top competitor on the OTC catalog. The top competitor has $300, but that company does not have rollover, okay? Personal emergency response, so this is the I've fallen and can't get up. That's coordinated through Lifeline is the company, and what the member needs to do is call into case management and order it, and then Lifeline can actually come right to their home and install the system. Now, the way we have it written, it is done by satellite. So they don't have to have a phone line to be able to have this, so they're not incurring an extra expense to add a phone line if they don't have one. So that's pretty cool from our standpoint. They get either a necklace or a bracelet, so if they do fall, they can push the button, or I mean, it'll get recorded as they're lying prone, but if they go to sleep, I believe there's a button that they push to show that they've gone to sleep. So it's not like they're going to get an emergency call while they're sleeping. Not all of our competitors have that. And some of the ones that do, they use the exact same company, but they don't have satellite coverage. They actually have to have that phone line in place. So it could be an extra cost to the member that maybe they just can't afford. It could be expensive. Fitness silver sneakers, we have that. Surprisingly, not all of the competition out there has that, but the big ones that you probably deal with, they do. Home safety devices. So in PA, we can get them up to 5 pieces of safety equipment. It's basically bathroom safety equipment. So it could be potty chairs, it could be shower bars, non-slip mats, those types of things. I think there's roughly 20 different things out there. When they call into case management, they'll go through with them. Here's what they have available to them. Which 5 do they want? It'll be shipped to them, free, all that good stuff. They just have to put it in. There's only one competitor that I can remember out there that even has this, and theirs is 6, okay? And then last but not least, we do have a 24/7 nurse hotline, and everybody else out there does. So to build a product that would be comparable to ours, it took me 6 different companies drawing from their best benefits to build this competitive plan. So, you know, I think whenever you start looking at us line by line, yeah, okay, somebody needs hearing aids, okay, that might be a pretty good deal on the other side, but I think whenever you start looking at dental, vision, OTC, transportation, all that extra stuff, you start adding it in, we present a strong argument as to why you should lead with Gateway. Next slide. So the next slide is our partial plan. So this is somebody who is going to be a little bit higher income level than a full dual, but they still qualify for partial Medicaid benefits. So on this plan, the Ruby plan we call it, they have a $0 PCP visit. There's a $35 copay for specialists. Lab and diagnostics is $0. I mean, you can see all that stuff right there. The premium on this is generally going to be $0. Now, technically, there is a premium. Technically, we have probably a handful of people that are on this plan that actually pay a premium, but I can't say 100% of the time, but it's going to be a tremendously high number percentage-wise that people aren't going to have a premium on this plan. So again, make sure that you're calling agent support and verifying eligibility, okay? So you can see, you know, we're pretty competitive on this. This is going to be in competition with a lot of $0 plans or plans that go to 0. So again, that across the state, that varies a tremendous amount. So I can't get into all of the different competitors. There's too many. We'd be here for days. So, but you can take this and look at it and compare it against maybe your $0 plan or a plan that goes to 0 on somebody that's 100% LIS and compare apples to apples that way. Next slide. This is just the extra benefits then of our Ruby plan. So we do have preventative dental there with a cleaning and exam, And with the vision, the same thing applies here with that Davis Vision. If somebody uses Davis Vision, it's going to be covered and it's going to be zero cost to them. And then our non-Davis is going to be $175 annually towards eyewear and contacts. We do have a hearing benefit that covers up to $750 every 2 years on the partial plan. And we do have transportation. So that's one of the big things that I find against the $0 plan or a plan that goes to zero. They don't have transportation. Now there's some out there that do, but most cases I don't see it. So again, this is a big deal because people need to get to their doctor or go to the pharmacy or that type of thing. And this is going to help with that. We do have an OTC benefit with this as well. It's $40 a quarter. So it's not that rich, but it's still better than zero. And again, it has rollover. And then it has the fitness silver sneakers also in it, and it does have the nursing hotline, okay? Next slide, 21. So go into the market. Next slide. So what do you do? Where do you find the dual population? So you got to figure out, where do they live? Where do they go for services? Where do they shop? Who are their doctors? Who are the dentists? What are the pharmacies? So you start looking at this, and it's not always easy to assume that Walmart pharmacy is where everybody goes. Depending on where you live, if you live in an urban area, you may have the local pharmacy down the street that's been there for 40 years is where everybody goes. So you can go in and talk to that pharmacist and tell them, hey, here's what I can do for your customers. You can show them the extra benefits. And, in their capacity as their pharmacist, they can bring them maybe a value-added service at their local shop. So you can set up there and have an information table or those types of things. Where do they shop? Or I'm losing my mind for a second. Sorry. So dollar stores, thrift stores, those types of places, those are going to be hit or miss. Some of them are national. Some of them will just say, sure, come on in. Some of them will say, hey, we got to go talk to the national people. So, you look at those places and you want to find them, but it's going to be hit or miss on that. Where else do they shop? Food banks. Those are tremendous areas to go to. Those are great opportunities to meet new people that you might not see all the time. Where do they live? There's a lot of low-income high-rises out there, but don't discount other areas. So not all low-income high-rises are 62 plus. So there are a lot out there or housing that is family-oriented. But remember, 40% of this population is under the age of 65. So you can't count those places out whenever you're doing your prospecting. Dentists. If you can find a dentist that is doing and accepting Medicaid and they're in our network or not in our network, you can talk to them about getting into our network. Let us know. We'll do everything we can to get them in. But if you can show a dentist that if they brought in 20 new patients and they're able to do work on them and get the $3,500 in comprehensive, that's a possibility for them to have $70,000 of increased revenue through their office. They're going to listen to you, and they might just let you set up right in their waiting room and do a benefits check right there for their people that are coming through the door. So those are some excellent things that you can do. One of our internal broker managers, whenever she was selling, she still has the same dentists calling her, giving her referrals from work that she did 5 or 6 years ago. So it's pretty cool. Also, don't forget disability lawyers, Medicaid planners. So disability lawyers, think about it. You probably see it on TV. Hey, qualify, you haven't gotten your disability yet? Call us. Go talk to those people. This is a value-added service that doesn't cost their members anything. So it's a pretty cool situation. We're starting to see a little bit out of that type of thing happening here in Pittsburgh, where we've actually brought in a couple disability lawyers into our home office and started talking to them. So we're trying to get this built. Medicaid planners. So, you might have a widow or a widower who is making $800 a month on their Social Security, and that's all they get coming in. but they may have an asset, so maybe an IRA or a 401k that might be $20,000. That puts them over the limit. You can start working with financial planners out there who may specialize in Medicaid planning, where they know how to get the assets out of that person's name. Their income is $800, and they're going to be able to qualify for Medicaid. So those are a little bit harder to find, but if you find somebody like that, you got to latch on, because it could be a tremendous relationship moving forward. And this is the one that's most embarrassing to me, natural market. My uncle had diabetes, really bad, had his leg amputated, has been on disability for well over 24 months, and I never thought about it. Didn't even talk to him about it. This past Christmas, I realized, what was I doing? He's been on disability for well over 20 months. He didn't even know he would be able to qualify for Medicare and Medicaid, get his health care basically taken care of, and I could get him onto our plan. So pay attention to what's going on around you. Don't be blinded by, hey, they don't want to work with me, it's my family, okay? So it's out there, we don't even realize it. Okay, next slide. So going to the market, what can we do to help? So Chris, Rob, Dan, even myself, we'll be able to, if you wanted to, we can get you out into the field and work with you on stopping and going into food banks. We can go in and show you how we make an approach to a low-income high-rise. So what we ask from you is, you want to pick your zone. So where do you want to work? Is it Harrisburg? Is it York, Lancaster, somewhere else, wherever? We can come out and do that with you. So we'll approach, we're not the end all to everything, but we're able to help you and show you what we do. And then we can go in and help you develop a plan of attack moving ahead. So this is something that you can coordinate through Christy to get with Chris, and then we can start to look at that type of thing. Next slide. Before we get into the conclusion, we hear a lot of rumblings out there about the CHC, and I think in Central PA that hasn't rolled out yet, but it's going to be. And then if you're in Eastern PA or Western PA, that has rolled out. So whenever it rolled out in Western PA last year, we were encountering some issues from a confusion standpoint, where the members were being switched from their access card and being put onto one of the new providers for their Medicaid. So that would be UPMC, Centene, and AmeriHealth, I believe. So those three companies are now basically, for lack of better terms, let's say they've become the Medicaid providers. So there was a lot of confusion. Western PA specifically, it seemed to be a lot worse, where people were being confused. They were jumping off of our plan onto other plans, not knowing. And then once they found out that they moved from our plan, they came back. So it was pretty confusing. Eastern PA, so the Philadelphia region, has been a lot smoother, we have found. So it's been tremendous. I think we have figured out how to get that information out there that, so your access card is changing to whoever you get assigned to, or whoever you pick, but that doesn't have any effect on your Medicare plan. So they would have whoever their CHC provider is going to be, and then they'd still have us or whoever else they may have as their Medicare side of things. So in a nutshell, they don't have to move anything from their Medicare side, and we've come up with a way to try and smooth that all out. So as that starts to come out, it's a little bit more one-off. I'm not the expert on it, but if there are questions, you can call in agent support or call over to Chris, and they'll be able to talk a little bit more about that.
Yeah, just to touch a little bit more on that, Brian, if you don't mind. I just want to read to the agents what the definition is. It's community health choices. So for those of you that aren't familiar with this, as Brian just mentioned, it did roll out west and already in the Philadelphia region as well. So January of 2020, it's going to be rolling out to Central PA and the Northwest part of the state. And what CHC is it's Pennsylvania's mandatory managed care program for dually eligible individuals and individuals with physical disabilities. And what it's basically doing is enhancing the behavioral management and basically managed care for the participants in these types of plans. As Brian said, it is not the end-all be-all. I would kind of compare it to PACE as a good example. You know, PACE always chooses the two plans they're going to work with. I think this year it's WellCare and SilverScript. That doesn't mean that if you're in PACE that you can only have those two plans. All the other carriers out there offering dual eligible special need plans are still available as options for beneficiaries. And I think that's a big misconception. Everybody thinks they have to go into the chosen plans, let's call them, and they don't have to.
Yeah, it's one of the things that we have found is people think that they get switched into the CHC, and at least out here in the West, it was UPMC was one of the CHC carriers. So they were actually making phone calls and getting people to switch from to the UPMC plan. And that was after 6 months on, they were allowed to do those types of things. So like I said, I think we've gotten that all straightened out. So it's really not been an issue for quite a while now. And we really didn't experience it out in the Philadelphia marketplace. So I think it's a much smoother transition and shouldn't present that much of a problem, but I'm sure there'll always be a hiccup here or there. So if you do run into anything, and if you're working in one of the zones that hasn't rolled out yet, we'll be very experienced and very well versed in what to do if something were goofy to happen come your time for the rollout in January 2020. All right.
Perfect.
Anything
and
else
I just have a blog coming out next month on our newsletter all about the CHC. So if you want to educate yourself on it, just look forward to our blog.
Perfect. All right. So slide 24 should be, hey, keep calm. It's the conclusion here. So we'll go to slide 25. Remember, what we learned today, Gateway, 100% D-SNP focused company. So, for us, we believe that we're the perfect partner for you to grow your D-SNP business. The opportunity is tremendous, and brokers, the vast majority of brokers are not attacking this marketplace. So, whatever the reasons are, it leaves the door wide open for you to walk through, and we're there to help you. Christy's team's there to help you. We have a great partnership there that we have one common goal, and that is to help you guys grow your business in the D-SNP marketplace. I think our products and benefits are very, very competitive out there in the marketplace, and I would dare any of you, to really go down line by line and do a comparison, our plan to any other plan out there in the market. And I think you'll see that we are, a very strong plan. And the last thing is, I don't know how many of the other companies out there are willing to actually spend time with you in the field and give you the tools necessary to go out into this marketplace and actually take you out and help you get some of these places scheduled on your calendar. We do have an outreach team now. We call it community engagement. They were on our team a year ago. We had some restructuring. They just were all moved to Medicaid. So we've been able to get them back here in the last couple weeks, and they are now out helping to build our name again in the regions by getting back out into the low-income high-rises, food banks, that type of stuff. So look to Chris. Chris will be looking for people at some point to start to man those places. So, let Chris know that you're interested, or let Christy know that you're interested, and she can coordinate with Chris agents that want to get out into that market. Go to the next slide. What's next? Well, what's next is the time is now. The greatest amount of time wasted is not getting started. And who said that? Dawson Trotman. I don't know who Dawson Trotman is, but man, does that make sense to me, because what is the worst thing that you can do is procrastinate. You know, if you started writing D-SNP today, where's your business going to be a year from now? You know, my challenge to you is not only look for what can it do for you now, but remember, come January 1st, if you write 50 new D-SNPs between now and the end of the year, that's 50 new people that are going to be paying you renewals come January 1. What does that mean to you? Just do the quick math. That's a big deal. So, yeah, I would attack now and look at it as, okay, yeah, well, we're going into July, blah, blah, blah. I'm not going to get paid. You know, I hear that all the time. But build your renewal base. What is that going to mean to you then? And what kind of difference is that going to make in your life moving ahead? Last but not least, next page, you know, Gateway. Remember, you're good with Gateway. We're here for you. We're going to be able to partner, do things, not only maybe directly with you, or we go through URL with Christy and her team again, getting you out into the field, doing the things, bringing you support, marketing materials, everything that you need to be successful. Last thing, you know, thanks for hopping on with me. I really appreciate the time. And remember, it's always time to get out there and sell. So thanks, Christy. Anything else that you need from me?
Nope, and we have no questions. So great job, Brian. We really appreciate your time and walking us through all of this today.
Yeah, I appreciate it again. Thanks for the opportunity. And, you know, we look forward to and continuing working with URL and all of their teams and downline. It's been a tremendous relationship, and they have some of the best people out there that we work with. So, I mean, we look to continue that. And if you're looking to get in, you're in an organization that we feel is top notch, and we can't wait to meet you if we haven't met yet. So everybody have a great day, great week, and we look forward to meeting you down the road here.
Thanks, Brian, very much. Have a good one.
Okay, take care.